As you know, on November 15, as the global population touched 8 billion, a girl born in Manila was declared as the symbolic 8 billionth person in the world. This event is a landmark global moment, but at the same time, it raises concern about the world's carrying capacity to support so many lives in a manner that every person deserves. High birth rates are particularly worrying in the Philippines, not least because they are being recorded amongst minors. The Philippines has one of the highest teenage pregnancy rates among Asian member states. Early childbearing may result in poor health outcomes, as we know. Pregnant adolescents are less likely to complete higher education and have lesser ability to earn more income over the course of a lifetime. Teenage mothers are more likely to experience violence and depression that can increase the risk of mental disorders. We also know that mothers with poor maternal health are more likely to give birth to a low birth weight baby. And this low birth weight baby will grow as a stunted child, a stunted teenager, and finally to a malnourished pregnant woman who in turn has another low birth weight baby, and the cycle persists through generations. So, addressing this fundamental development problem is not only addressing a critical public health issue, but also saving lives and reinvigorating a society. So the decision of the Republic of Korea and the government of the Philippines to engage in such transformative initiative deserves all the recognition of the United Nations. Why? Because it represents a concrete investment in the Sustainable Development Goals. So we are also grateful to the Department of Health and the Korea International Cooperation Agency, KOICA, for their trust in the United Nations as the main implementing partners. 3 experienced UN agencies, UNFPA, UNICEF, and the World Health Organization, the 3 of them are bringing all their global knowledge and best practices to make of this program a great success. So we thank Korea for its vision in building this meaningful alliance. In fact, this joint program resonates with the Republic of Korea's New Southern Policy vision of a people-centered community of peace and prosperity founded on the Sustainable Development Goals, or SDGs. As a resident coordinator, I'm also proud that we joined the Department of Health in reaching critical areas. This joint program will be implemented in Southern Leyte and Samar in Eastern Visayas, recognizing that those areas are seriously impacted by teenage pregnancy and inadequate reproductive health services. As we know, this joint program also calls for right to education, knowledge, supporting environment and structures, and adolescent-friendly services delivered through participatory, community-based, and disaster-proof interventions. I'm also proud to mark the launch of this joint program with all of you, and I have high hopes that it will significantly contribute to national and local government efforts to address adolescent pregnancies. We celebrate this new partnership with the Department of Health, and we thank the people of the Republic of Korea and KOICA for this meaningful and very timely support. Maraming salamat po. Thank you very much.